Welcome, class. Dr. Lindner. We are still on neurology and we are on the brain. This next section, we're going to talk about the cerebellum. Now, I don't want you to confuse the cerebellum with the cerebrum. They're not the same. So, cerebellum, remember that's on the posterior part of the brain, just inferior to the occipital lobe. So, when we're looking at the brain here, the cerebellum is what we see right there, that small little section. Okay, it's the inferior and the posterior aspect of the cranial cavity, and it consists also of two hemispheres, much like the cerebrum has two hemispheres. It has a left cerebral hemisphere and a right cerebral hemisphere. When we talk about the cerebellum, there's two cerebellar hemispheres, a right cerebellar and a left cerebellar hemisphere, separated by this structure in the center that's called the vermis. So again, you can see the two lobes. Here's one, here's the other. And again, it is separated by what we have right here in the center. That's called the vermis. Now, what does the cerebellum do? What is its primary functions? So it's designed to help us deal with the sense of balance or the sense of equilibrium. And it corrects voluntary muscle contraction and posture, right? It makes these modification or adjustments to muscle contraction and posture based on the sensory information that the body receives in relationship to what its purpose was, right? So if I'm throwing a baseball to someone that's 10 feet in front of me, but I'm being a little bit aggressive when I throw it and it goes over their head, the information is going to be processed and I'm going to modify that. So next time I throw the ball, it may not be as aggressive or as forceful. So the cerebellum receives like a photocopy message of what the frontal lobe and the motor cortex, that pre-central gyrus, when that sends motor commands and motor information out for a voluntary type of muscle contraction, the cerebellum is getting a photocopy message of that. And it can make these slight adjustments when needed. So the cerebellum functions in the coordination of skeletal muscle contraction and in the maintenance of normal muscle tone, posture, and balance. It stimulates the parasympathetics, which inhibits the sympathetics, which can lower blood pressure to the arms. So this is something that's really important because when we look at blood pressure, most people, when they get their blood pressure taken, they just get the blood pressure taken in one arm, but it's really important to get blood pressure taken in both extremities. And not just once, it should actually be taken at least twice to confirm what your first reading was. But sometimes you'll get a reading on one side that's significantly higher than the other. And not many people talk about the cerebellum in relationship to blood pressure. But what it says here is that the cerebellum stimulates or sends messages to the parasympathetics. And when it sends information to the parasympathetics, which is the more calming system, right? Feed and breed, rest and digest, that inhibits the sympathetics. And when you inhibit the sympathetics, you can lower blood pressure. So you may have what we call escape, which is where it doesn't inhibit the parasympathetics, and you just may get a higher blood pressure on one side. So the cerebellum just isn't involved in balance and equilibrium and modifying and correcting posture and balance, but it is involved in trying to send messages out to the parasympathetics to keep that blood pressure on the lower side. If it's not sending messages to the parasympathetics on even one side, you'll get this difference in blood pressure. Okay. And if you have a blood pressure that's different by at least 10 millimeters of mercury on one side than the other, that increases the incidence of a cardiovascular event. Okay. When we take a close up look at the cerebellum, you'll see that it kind of looks like a leaf, and then you have like the veins of a leaf. So we have one region called the arbor vitae. And if we look at the arbor vitae looks like the veins of the leaf. And then we have a region called the folia. So the veins of the leaf on the inside is white matter. And then what we have, the folia, which looks like the word foliage, right? When you have nice foliage, you have those leaves that are changing color in the fall, right? The beautiful foliage. So folia means leaf. That's the gray matter. And that's what happens in the brain, right? You got gray matter on the outside, and then you have the white matter, the veins of the leaf, on the inside. Okay. And arbor, just think about what happens on Arbor Day. Arbor Day, arbor vitae literally means the tree of life, the tree of life. And what you see that's traveling down adjacent to this cerebellum right in here, that's your fourth ventricle. Remember, you have four ventricles. There's the lateral ventricles, one and two. Then there's the third ventricle. And then we have the fourth ventricle. So right here, adjacent to the cerebellum, is the fourth ventricle. And remember, CSF can flow right down and go right down here, down the central canal of the spinal cord. Or it can exit and kind of go through the lateral and median apertures. What else can we see here in this region that we've already covered? In this lower section right here, that's the medulla oblongata. Up a little higher, there's your pons. And then this section right here is your midbrain. So the midbrain, the pons, and the medulla, that's your brain stem. When we did the midbrain, remember we had these two bumps, two on the left-hand side, and then there's two bumps on the right-hand side. And those four bumps would be considered the corpora quadrigemina, which is made up of two superior colliculi and two inferior colliculi. Again, that's in the midbrain. If you think back to the midbrain, the important structures, we said red, black, and the twins in the back. The red for the red nucleus, the black for substantia nigra, and the twins in the back are the two superior and the two inferior colliculi. The cerebellum, if a police officer pulls someone over because they saw the car swerving in and out of lanes, a police officer may ask you to step out of a car and walk heel to toe, heel to toe. When you do that, they're checking for your balance. They may ask you to touch your finger to your nose, and finger to nose is more of like precision and accuracy. Again, that is cerebellar function. Some people, with their eyes closed, they can't touch the tip of the nose. They may do here and then make a correction. Or you'll see the finger shake a little bit. Again, those type of tremors could indicate a breakdown in cerebellar function, because it's supposed to, when the cerebellum is activated, create smooth movements. Okay, when we come back, we'll talk about the diencephalon